Oliver was born with a cleft lip and palate in 2005. He had a bilateral cleft lip. As he got older, there was quite severe speech delays.
Well, children with cleft palates, their speech outcomes can vary from completely normal speech to completely unintelligible speech, and every stage in between. And obviously, if they've got completely unintelligible speech, that has an impact on education, social relationships, work, everything. I usually see children for the first time at 18 months. Sometimes I'll see them earlier than that if I'm actually rotated to be on one of the multidisciplinary cleft clinics. So they may only be a few weeks old when they come to that. And then I follow them up at least until mid-teens. So it's the whole age range, but predominantly young children. Children that have come through the general speech and language service who have hypernasal speech would be referred on to me for assessment, and if I feel it's appropriate, they're then passed on to the cleft team for further assessment and possible surgery. So it's a kind of filter system, getting them through to the surgeon. Because the surgery that they may need will be the same as the speech surgery that children with cleft palate would need. An 18-month assessment and then a 3-year, slightly more formal assessment that's a screening assessment of every aspect of speaking. So it looks at understanding, expressive language, speech sound production and resonance. Because that's the kind of age where if there are got to be problems and we're looking towards further speech surgery, that's the kind of age that we will be wanting to start. Yeah, and a lot of the therapy will be done whilst they're quite young as well. But then there are standard audit assessments done at 5, 10 and 15 years. We do also have strong links with an ENT surgeon, but they're not usually actually present at the MDT clinic. A cleft surgeon, orthodontist, psychologist, specialist nurse. Although the surgeon has the final say on what surgery is done and when and so on, a lot of what he does is informed by speech assessments. So there's basic surgery that is done for cleft palate, but then there is further surgery that may be necessary, and that is entirely dependent on how speech develops. So his decisions are informed by speech therapy assessments.
He knew everything. It was more to do with he couldn't actually articulate what he wanted to say. All the sounds tended to go into a couple of sounds, which was M and G and N seemed to be the only sounds. Everything began with those sounds. He was about 18 months when he first started having regular sessions with a speech therapist. A lot of it was play to begin with, and then just working out what sounds he was using and then putting into place the best sounds to work on. So he started working on the P and D sound. It's taken a long time to get him to a point now where people can understand him, but he's doing really, really well. The school have been really good. They were happy for me to delay him a year to allow him that time to just learn how to talk, really. And then once in school, from nursery, he's now in reception, but from nursery they started sort of liaising with the speech therapist. They've inputted things in school, and he doesn't have problems in school. His friends can understand him, his teachers can understand him. Without all the background that's been put into him in terms of speech, he just wouldn't. He'd know what he was saying, but nobody else would know. And that in itself would present problems for him, because he would get very frustrated when he knew what he was saying and nobody else did. I just think they've worked so hard with Oliver, and you know, it's difficult to try and get a child to understand, you know, 18 months, 2 years of age, what you're actually doing, but the way they worked with him at that age was really brilliant. And the tricks that they have up the sleeve to try and get him to do what they need him to do. Yeah, he's more or less there now, really. There's only a couple of sounds that we're just kind of sort of picking up on now. But the majority of the sounds he's got. And without that input from speech therapists, he would be struggling now in school to be understood. You know, he's now learning to read and things like that. And I just think it's amazing. You know, he's had weekly input for a very long time. And they've worked so tirelessly with him, really. You know, because getting a 4-year-old to sit down and concentrate for any length of time is a miracle in itself, really. For a long time, he's sort of working on the same sounds, and you kind of think, you know, he's never going to get it, and they just keep going and going, and you know, and eventually it clicks and he can do it, and then you can see how he feels as well. You know, the joy that it suddenly clicked in his head and he can do it, and that confidence that comes out of him then is just, it's brilliant. I can't thank them enough, really, for what they've done. Then it's been a lovely journey in a way to see him go from this tiny little thing who couldn't get across his point, and now he can chatter for England. So